Dear members, you are welcome to this lecture. We are yet continuing with gynecology. Today we are going to look at abortion. And I'm by name Kiden Robina, taking you through this. So let us look at bleeding disorders in pregnancy. In simple terms, we can talk about it as abortion since we are looking at it before the end of the 28 weeks, which is known as early pregnancy. So, bleeding in pregnancy refers to any vaginal bleeding during pregnancy. When the woman becomes pregnant, we expect that the menstrual periods cease. Actually, that is one of the factors that can make the woman to suspect that she is pregnant when she stops seeing her periods. So, if she's already confirmed to be pregnant, then again she starts bleeding vaginally, then that means that it is something abnormal, which actually requires attention. So, a borderline condition, it is a borderline condition between obstetrics and gynecology, because some of the causes can be obstetrical and the others can be gynecological. That's why it falls between obstetrics and gynecology. We look at it in gynecology and we also look at it in obstetrics. Treatment setting can be managed in gynecological wards. Significance: even slight bleeding may signal life-threatening emergencies. For example, ruptured ectopic pregnancy, incomplete abortion. All these are life-threatening emergencies which need immediate attention. So, bleeding in early pregnancy occurs before the 24th week of pregnancy, and the causes can be abortion, can be ectopic pregnancy, can be hydatidiform mole, can be those are the things or factors that can make a woman to bleed in her early pregnancy. So let us now go into abortion. So abortion refers to expulsion of the fetus or termination of pregnancy before the 24th week of gestation or before viability. Some books, especially there are some books that state 24 weeks, because most of the books that are written in the European countries are based on their technology. After 24 weeks, the fetus can be able to survive. Actually, the fetus is termed as viable. But in poor countries and middle income countries, before 28 weeks, the fetus is not. When is above 24 and 8 weeks, that's when the fetus can be able to survive even if it's produced prematurely. So here we are looking at abortion. So in the low income countries, actually, the termination of pregnancy before 28 weeks is what is termed as abortion, because before 28 weeks is not able to survive. Whereas in other, in European countries, the 24th week, after the 24th week, they can be able to survive. But we pray that technology improves and also the low income countries, we shall also be able to have the advantage. So the legal definition in the courts of law or concerning the legal issues, abortion refers to delivery of fetus less than 20 weeks of gestation or less than 500 grams of weight. So terminology, abortion and miscarriage are synonymously used, but abortion often carries a stigma implying criminal induction, and that is why in some cultures we don't mention that. We rather mention miscarriage other than abortion. Classification of abortion. So abortion can be classified into spontaneous and induced. Under spontaneous, we have threatened. It starts as it can be starts as on its own. After that, they end up being um, expelled out. On the other hand, under induced abortion, this is actually a kind of abortion that is initiated, can be therapeutically or manually, as we shall look as we continue in this lecture. So, in induced abortion, we have therapeutic abortion, then criminal abortion. Therapeutic, this one is the one that is done for the purpose of survival of the mother, and in most cases, it is done in the hospital. So it can be done to save the life of the mother, or it can be done purposely because the baby has abnormalities, and even if he's born, will not be able to survive. Then criminal abortion is the one that is carried out, initiated outside of uh, the hospital or health facility. So the therapeutic can result into septic, complete or incomplete. Criminal can also result into septic, complete or incomplete. So under threatening abortion, it can end up to be missed abortion or inevitable. It can spontaneously start. Then after that, the signs and the signs disappear. Then the woman will not feel anything. She will think that her pregnancy is growing, but yet the pregnancy is not growing. So after a period of time, then she will have some spotting, and in most cases, when checked, the fetus is already dead in the womb. That is what is termed as missed abortion. Then it can be inevitable, whereby it uh, threatens, then it proceeds until the products come out. So the inevitable one can continue to be incomplete or complete. When it is incomplete, it means that an action has to be taken by a healthy worker to save the life of the mother. But if it is complete, then it's okay. And sometimes when it is complete, it may turn out to be habitual, where the woman conceives and she regularly has abortion or miscarriages. So the missed abortion can proceed to form a blood mole, or it can form a canious mole. So a canious mole, it will be like a fetus which is pale, and pale actually because it's not having any life in it, and in most cases it has even disconnected, or it has detached from the placenta itself. Then the threatening abortion may threaten, then it may normalize, then it ends up going up to term. It grows until term. So let us look at causes of abortion. Can be maternal causes, and under this we have systemic diseases like hypertension, chronic heart diseases, acute febrile conditions like malaria, pyelonephritis, and pneumonia. These can all result to abortion. Then we have also endocrine disorders such as thyrotoxicosis, uncontrolled diabetes mellitus. Local uterine conditions. Under this, we have underdeveloped uterus, fibroids, congenital abnormalities, for example, septate or biconate uterus, making the space to be very tiny for the fetus to develop. Then cervical incompetence, can be congenital weakness or can be due to trauma or lacerations from previous childbirth, which result to the uterus, the cervix not being able to hold in place to make sure that the fetus grows well and safe. Then fetal causes, which are 75%, the maternal causes make up 25%. So most of the causes of abortions are actually fetal causes. So here we have chromosomal or genetic abnormalities. There are some fetuses that are formed and they are actually abnormal. And once the body detects this, then it does away with it. Then it results into abortion. Then we have congenital malformations. We have exposure to harmful agents like viruses, chemicals, or radiation. Abnormal placental attachment, for example, belated ovum or poor implantation. Then we have miscellaneous causes, other causes apart from the fetal and the maternal, and these are accidents, for example, falls and injuries. Then we have criminal interference, use of drugs, herbs, and the instruments to make sure that the fetus is terminated. Signs and symptoms of abortion, we have vaginal bleeding, which is due to partial separation or detachment of the ovum. Then cervical dilation, which is inevitable, abortion, when the cervix is now dilated and the woman is bleeding severely, it means there is no way this fetus will be retained, automatically it will come out, and this we term it as inevitable abortion. Then expulsion of the fetus and membranes, this is also one of the signs. Important notes, slight or moderate bleeding does not confirm fetal death. Take all measures to save life. So once the woman is bleeding or if the bleeding is either slight or moderate, it does not confirm that the fetus is already dead. So all means have to be taken to make sure that the fetus survives. For example, the woman needs to go for ultrasound, and if confirmed that the fetus is viable, then the complete bed rest and other measures have to be taken. More so in investigation on febrile conditions like malaria and typhoid that normally cause kind of bleedings in pregnancy is very important, so that can be treated immediately to save life of the mother and the baby. Then complications like ectopic pregnancy, antepartum hemorrhage, and PROM are more common with any IUCD in situ. So in case the woman was using intrauterine contraceptive device and she conceived with it, it is very likely to cause bleeding and sometimes can lead also to ectopic pregnancy. So the measure that has to be taken is immediately the woman conceives, when she is having the IUCD in situ, it needs to be removed immediately. Types of abortion, we have spontaneous abortion. This occurs naturally without any medical intervention. It typically happens before 20 weeks of pregnancy. Then we have induced abortion. This is a medically or surgically performed abortion, typically carried out for reasons such as maternal health risks, fetal abnormalities, or personal choice. We continue with the types of abortions. Under this, let us look at types of spontaneous abortion. So, under spontaneous abortions, we have complete miscarriage. All pregnancy tissue is expelled from the uterus and nothing remains. Then incomplete miscarriage, some tissue remains in the uterus. So in this case, a step needs to be taken for those tissues to be removed so that the life of the mother will be saved. Then threatened abortion symptoms like bleeding suggest a miscarriage might happen, but the pregnancy is still viable. And in most cases, the cervix is not dilated. Actually, in threatened abortion, the cervix is not dilated, whereas the mother is bleeding, but the fetus is also viable. Then miscarriage, the pregnancy stops developing, but the tissue is still retained in the uterus. So with the time, the mother will just realize that the uh, the abdomen is not increasing in size, is remaining the same or is even reducing. So then with the time she starts spotting and it needs to be removed out or sometimes it can come out spontaneously. Recurrent miscarriage, 3 or more consecutive spontaneous miscarriage termed as recurrent miscarriage. So let us look at complete abortion. Complete abortion involves entire products of conception being expelled. Pain and bleeding decrease because everything has come out. Cervix closes. Uterus reduces in size because everything has come out. Then this one is mainly common before the 8th week of pregnancy. Incomplete abortion. In this type of abortion, fetus is expelled, but placenta or membranes are retained. Retained tissue causes continued bleeding. Uterine bulkiness and the cervical os remains open. So these have complications, and these include profuse bleeding, shock, and anemia because of the too much loss of blood. Then symptoms include weak rapid pulse because of going into shock, low blood pressure, dyspnea, the person will breathe with a lot of difficulty, then cold and clammy skin. All these are signs of shock. Management of incomplete abortion. Initial steps. Take history and inspect the expelled products. Administer oxytocin, e.g. egometrine, 0.5 milligrams, then syntocinon, 1 ml. Correct hypovolemia with IV fluids, for example, saline and Hartmann's fluid. Ongoing management. Inspect expelled tissues to ensure complete evacuation. Stop analgesics, for example, pethidine, 100 milligrams, and many strong analgesics, for example, pethidine 100 milligrams, can be given for pain relief. Then keep patient warm. Elevate bed foot to maintain vital blood supply. Then monitor vital signs every 15 minutes and prepare for dilatation and curettage if evacuation is incomplete. Now, here, when the pregnancy is 12 weeks of amenorrhea and above, then the mother has to be prepared for dilatation and curettage, because in this case, MVA, or what is termed as manual vacuum aspiration, will not be able to remove the products. So minimal disturbance, we are now looking at threatened abortion. Minimal disturbance, pregnancy may continue to term with good management, but damage can progress. So signs and symptoms of threatened abortion, we have slight vaginal bleeding, mild lower abdominal cramps without actual pain, cervical os closed, no expulsion of the pregnancy sac, common in the first 20 weeks. Management of threatened abortion, the mother should have bed rest and reassurance, mild sedation, phenobarbital, morphine, or pethidine if pain is severe. Advice to use the pads or cloths for examination by the doctor or the nurse who is taking care of the patient to ensure that the blood loss is being monitored to see how much blood the patient has already lost. It guides in management of the patient. Avoid physical exhaustion, appearance, and sexual activity. So the mother should not get involved in activities that will exhaust her, and also sexual activities are prohibited. Low residual diet, vital signs monitoring, and hygiene care. Discharge advice, rest, avoid strenuous activities, regular clinic visits, and good nutrition. Inevitable abortion, pregnancy can be saved. The fetus must come out. I beg your pardon, pregnancy cannot be saved. The fetus must come out. So that's why it is termed as inevitable. There's nothing you can do, however much you struggle, to save the pregnancy. So signs and symptoms include severe vaginal bleeding, often with clots, intense backache and abdominal pain, cervical os dilating, uterine contractions palpable, and possible rupture of membranes with products of conception visible. Post-DC D and C, care in inevitable abortion. So in inevitable abortion, there's nothing much you can do. Here we are aiming at saving the life of the mother. And this one can only be saved through ensuring that the products of conception are removed. And this can be removed through dilatation and curettage. So which care do we give to the mother after the dilatation and curettage? We have to monitor for shock, vaginal bleeding, pulse, respiration, and urinary output. Ideally, after the dilatation and curettage, the bleeding should be very minimal, then it should stop because the products have been expelled all. Detect kidney complications like tubular necrosis manifested by oliguria. Administer Silbostro tablets to suppress lactation for late abortions. In late abortions, the breasts may start producing milk because the breast will assume that the mother has given birth. So in that case, medication like Silbostro have to be administered to suppress that milk production. Complications of D&C, uterine perforation, if not performed well, cervical incompetence, pelvic inflammatory disease, and the infertility. Habitual abortion or the current abortion, 3 or more consecutive spontaneous abortions associated chronic maternal illnesses, for example, diabetes, nephritis, tuberculosis, Then uterine and cervical abnormalities, endocrine or genetic factors, especially for less than 18 weeks. Then infections such as syphilis. These ones are the ones that normally abortions. The woman has a she happens times, then we habitual or recurrent. So features: cervical incompetence occurs late in the second trimester, in most cases 22 to 24 weeks. This is a sign that the baby has gained weight, and because the cervix is weak to hold the weight of the fetus, then it will have to come out, and this is due to cervical incompetence. Then sudden rupture of membranes and expulsion without warning. Fetus appears fresh because actually it has not suffered from anything like infections that would alter its looks. Recurrent abortion management. We need to identify and treat the underlying cause. Diet rich in proteins, vitamins, and minerals is important. Adequate rest, avoid strenuous activity and coitus. Surgical correction of genital abnormalities. For example, Shirodka stitch for cervical incompetence can be stitched when the pregnancy is still young, then removed when the mother is going into labor. Missed abortion, threatened abortion where symptoms, bleeding, and pain stop, but the fetus is no longer viable. Features: loss of pregnancy symptoms, uterine enlargement stops, pregnancy test positive, brownish discharge without pain after weeks indicates fetal death. Management of missed abortion. Administer ergot or silbostro to expedite expulsion. Surgical evacuation if products are retained. Curettage and oxytocin for persistent bleeding. Blood mole or Carnias mole. Definition: a complication of missed abortion, forming a fleshy firm mass due to retained zygote surrounded by blood layers. How can this be managed? It can be managed by following the steps that are similar to management of missed abortion. Induced abortion, deliberate evacuation of the uterus via drugs or surgery. The types: we have therapeutic abortion, which is done for medical reasons, e.g., maternal life risk, or fetal malformation, or rape or incest. All these reasons are important for the therapeutic abortion to be conducted. Methods: it is conducted before 12 weeks through manual vacuum aspiration or MVM. Then after 12 weeks can be done through the administration of prostaglandins. Types of abortion. We continue with the criminal abortion. Performed outside professional care or often unsafe. And the complications is it leads to hemorrhage, sepsis, renal damage, injuries to reproductive organs. Septic abortion, abortion complicated by uterine infection, often due to criminal abortion or bacterial contamination in spontaneous abortion. The causes can be common pathogens, e.g. E. coli, gram-positive streptococci, staphylococci. The features include general malaise, then fever of greater than 38 degrees Celsius, rapid pulse, abdominal tenderness, bulky, soft uterus, offensive pinkish vaginal discharge, and complications, endometritis, peritonitis, septicemia, septic shock. It can be managed through immediate administration of antibiotics, evacuation of uterine contents, and supportive care. So that marks the end of our today's lecture. Thank you for being part of this.